Hello, Michael Greenspan here, Neuromuscular Therapist from Get Pain Free TV, here to talk to you about the gluteus maximus muscle, a muscle that is often at the root of lower back and hip pain, a muscle that tends to atrophy, yet it's also very much used. It tends to atrophy because we sit on it, because we sit and we kind of slouch instead of sitting up on our sit bones. When you sit up on your sit bones, that muscle tends to not atrophy and waste away. But when you slouch and kind of round at your desk, it tends to get compressed, and then it tends to atrophy and get weak. So this muscle often is and does cause lower back and hip pain. And like I said, it's a very big muscle. It actually attaches almost halfway down your thigh. Most people think about the gluteus maximus muscle as just the buttocks. But if you look at a horse very carefully, you'll notice that gluteus maximus muscle goes all the way down, halfway or almost about a third of the way down the leg. It keeps going, the fibers. So it's just like in humans. The fibers of the gluteus maximus muscle come all the way down and attach into your leg. So what it does is it really pulls on your thigh, and it can really put us out of alignment. And there's really great ways to learn how to release that muscle on your own, how to get that muscle treated, the trigger points, which are often these landmine knots. You can see these T's, these little circles right here, that radiate pain like these little explosions, these explosively landmine knots. And they cause pain deep in your hip, deep in the back of your buttocks, and a little bit down the back of your thigh. You can see those red marks. So there's some great postural alignment exercises that you can do to stabilize your pelvis so that muscle never gives you any problems. There's some great techniques to release it on your own. Check some of the other videos out to learn how to treat that muscle, to get out of pain. Opt in for your free videos in order to get more information. And thank you so much for checking in.